We start this bulletin with a warning from the government that you may not get a hospital bed in Nairobi as all are occupied. Painting the grim picture, Health Cabinet Secretary Mutahi Kagwe said hospitals in Nairobi are overwhelmed as the COVID-19 situation in the country continues to worsen. And as Chemutai Goin reports, there are 1,432 COVID-19 patients admitted, of whom 175 patients are under intensive care unit.
500 days since the first case of COVID-19 was reported in the country, and the future remains bleak. Health Cabinet Secretary Mutahi Kagwe, who chairs the National Emergency Response Committee, today is signaling tough times ahead. The Delta variant of the coronavirus disease, which is now the dominant variant, is spreading like wildfire.
Today, the Nairobi hospitals are stretched to a limit. And the truth of the matter is that if you fall sick today within this county, you are very unlikely to get a hospital bed.
While expressing concern over the increasing infection rate in 9 counties, Kagwe said if the COVID-19 cases continue rising at the current pace, there will be no space in hospitals for the patients seeking urgent care.
But the truth of the matter is that unless we can contain it at this level, unless we can stop the transmission right now, then it is possible that our health system is going to be overwhelmed. And when that happens, then you have got the scenes like you see in other countries. You saw it in India, where a person dies right in front of a hospital, and there is nothing that the doctors can do.
The surge in new cases has increased the demand for ICU beds, yet the country still faces substantial gaps in ICU bed capacity and ventilator space. Kagwe today revealing that the prevailing situation has pushed the government to increase the ICU bed capacity at the Kenyatta National Hospital and the Kenyatta Teaching and Referral Hospital by 28 beds. The Nairobi Hospital also set to add 20 more ICU beds. However, besides the beds, the country faces a looming oxygen shortage. As such, counties have been directed to pipe oxygen to the health facilities to reduce the use of cylinders, even as the government moves to install oxygen plants. The 9 counties that have been put on high alert include Kiambu, Kajiado, Lamu, Makueni, Murang'a, Nairobi, Nyandarua, Taita Taveta, and Tana River.
As individuals, we must ask ourselves whether our behavior is contributing to the solution or our behavior is contributing to the problem. We continue to emphasize that it is not possible for police to police every individual individually.
Keep yourself safe from the disease and also keep yourself safe from any enforcement measures.
And over the last 24 hours, the country's positivity rate remained high at 13% as 945 new infections were recorded. 1,442 patients are admitted in various facilities across the country, 3,975 on home-based care and 175 in ICU. Out of the 175 in ICU, 41 are on ventilatory support, 528 on supplemental oxygen and 52 under observation before being moved to the recovery wards. 400 are in general wards and 46 in the high dependency unit. 16 deaths, albeit late deaths, were recorded, pushing the total deaths to 3,926. With the National Emergency Response Committee identifying adherence to containment measures as the weak link in the war against COVID-19, over the next few weeks, enforcement agencies are expected to step up their operations, even as the government continues to urge Kenyans to ensure that they are part of the solution and not the problem. Chemutai Goin, Citizen TV, Nairobi.